ITLS 80 Advanced Pre-Test Exam Questions equals eye injury. Suspect, in an alert head injury patient. Equals. Hyperventilation results in, /, equals NS 5001000 ml via RIVB, then ITLSOE. 25 XXC/O stab wound to left arm, lock AMS, S/S shock, bleeding controlled with direct pressure plus tourniquet appropriate for fluid therapy equals CSH. Stands for cerebral herniation syndrome. Equals SVR and CBF. For TBI patients, routine hyperventilation causes. Equals provide supplemental O. 57 XYC/O trauma, RR36, ETCO, 30, SPO, 80 U should, action, equals tension pneumothorax. Is the most frequent cause for an intubated trauma patient to develop poor lung compliance during ventilation, equals tissue density. Generally, traumatic damage is directly proportional to equals lock. Until proven otherwise, is always due to substance abuse, head injury, shock, BGL, equals pediatrics. The most common was in patient population are falls from height, standing, MVCs, automobile pedestrian or bicycle crashes, burns, submersion injuries, abuse, equals improves glottic visualization. The use of external laryngeal manipulation, result, equals scared. Use the mnemonic to remember when to interrupt ITLS 1 degree S, equals tibial tuberosity. The easiest IO site is the equals cervical. In a rear impact MVC, the region, spine is most susceptible to injury, equals pericardiocentesis. The purpose of A/N is to remove fluid from the lining around the heart, equals ICP. Is the most likely cause of unequal pupils in a head injury patient with AMS, equals CSH. Patient, lock, coma, pupillary dilation without down deviation on unaffected side, decerebrate posturing. The described patient is most likely suffering from, equals hand or battery. Suction devices should be driven, equals ETCO, M+M. Is the gold standard confirmation method for tracheal ETT placement, equals pulmonary contusion. Occurs when blunt/penetrating trauma causes hemorrhage into lung parenchyma, equals beards, or other facial mods. The B in the boots mnemonic stands for equals lung compliance. While performing BVMVs, you notice difficulty in squeezing the BVM, a sign of equals pests. Stands for priority escalating situations for transport, equals intrathoracic/abdominal hemorrhage. 45 XXC/OMVC, lock unconscious, BP 80/40ths, HR 130, RR30. The most likely cause for her vital signs is, equals treat as a head injured patient. 23 XYC/O motorcycle collision, large, actively bleeding scalp laceration, lock disoriented, appears intoxicated, does not want medical attention. You should, equals do nothing. You just placed an NPA and now notice mild nasal hemorrhage, so you, action, equals return of peripheral pulses N slash or SBP 80 to 90. 56 YOXYC slash OGSW to abdomen, BP 74 30 seconds, HR 136, carotid only, RR 24, shallow fluid resuscitation should be titrated to, goal slash target, equals mechanical. In part, cardiac function is based on, contractions, equals cardiac arrest. The C in the scared mnemonic stands for equals, O, and slash or, CBF. Results in secondary brain injury. Equals proximal humerus. The most efficient and effective IO site is the equals 4 NS titrated to return of peripheral pulses. 34 YOXYC slash OGSW to right groin area, arterial bleeding from wound, not controlled with direct pressure slash tourniquet, lock confused, C. Skin diaphoretic, C. Weak peripheral pulses. Appropriate fluid resuscitation for this patient is, equals prioritize the patient and ID all immediate life threats. The purpose of the initial assessment is to equals delegate. During ITLS 1 degree S, the team lead should, action, to minimize errors, equals exsanguination. The E in the scared mnemonic stands for equals delegate. The D in the scared mnemonic stands for equals safety compromised. The S in the scared mnemonic stands for equals SBP 110 to 120. For a patient with TBI, fluid resuscitation should be titrated to goal slash target, equals anterior axillary line. When performing a needle decompression, insert the needle directly over the top of the fourth rib at the equals pulmonary contusion. Occurs commonly with flail segment or multiple rib fractures. Equals decerebrate. 15 YOXYC slash O blunt force trauma to the head after being struck with a baseball bat. AVPU unconscious, arm and leg extension, right pupil fixed and dilated. This patient demonstrates posturing, equals on scene. The following procedures are performed: major external hemorrhage control, establishment and maintenance of patent airway, ventilation with supplemental O, CPR, sucking chest wound sealing, flail segment stabilization, needle decompression of tension pneumothorax, establishment and maintenance of SMR, stabilization of penetrating objects, equals S/S airway compromise. Snoring, gurgling, silence, stridor, equals HSA. Stands for hemostatic agents, equals pericardial sac. The is an inelastic membrane that surrounds the heart. Equals return of peripheral pulses N slash or SBP 80 to 90. For a trauma patient with internal, uncontrolled hemorrhage, fluid resuscitation should be titrated to goal slash target, equals 35 to 45. In the absence of herniation syndrome, adult patients with suspected traumatic brain injury should be ventilated to ETCO, equals snores N slash or stridor. The S in the boots mnemonic stands for equals airway compromise. The A in the scared mnemonic stands for equals CSH. Is the only situation for which hyperventilation at RR20 is still indicated, equals 60. Squeezing the BVM generates pressures, CMH, O. Equals obesity in older patients. The OO in the boots mnemonic stand for equals. Hypoventilation results in / ETCO equals CBF. Stands for cerebral blood flow. Equals disturb clotting and reactivate bleeding. Removing an NPA in the presence of mild nasal hemorrhage may equals direct pressure. Direct HSA application to the bleeding source must be used with equals assess and manage any other potential life threats. A 36-year-old male sustains blunt force thoracic trauma and fits the criteria for a low dango patient. You should, on scene, equals thyroid cartilage. During ELM, one manipulates the to help visualize the vocal cords. Equals electrical. In part, cardiac function is based on stimulation. Equals teeth and / or other dental modifications. The T in the boots mnemonic stands for equals massive hemothorax. 31 YOXYC/O trauma, sob, C, pulse weak, rapid, neck veins flat, trachea midline, left LS, left chest dull to percussion. This patient is most likely experiencing equals modified jaw thrust maneuver. For YOXXC/O fall from bicycle, lock unconscious, you open the airway via equals peripheral pulse production and / or SBP 80 to 90. In trauma, indicate /S adequate relative perfusion. Equals tension pneumothorax. Decreased lung compliance in an intubated patient should always alert you to the possibility of A/N. Equals respiratory compromise. The R in the scared mnemonic stands for equals tension pneumothorax. 27 YOXYC/OMVC, blunt chest trauma, successful ETI while ventilating the patient. You note resistance with absence of right chest wall movement, indicating A/N, equals spinal cord. The attached figures MOA will most likely injury the equals exigent. Penetrating torso wounds, abnormal chest exam, tender, distended abdomen, pelvic instability, bilateral femur fractures. A trauma patient with any of the above is classified as transport level. Equals BVMVs at RR20. 15 YOXYC/O blunt force trauma to the head after being struck with a baseball bat. AVPU unconscious, arm and leg extension, right pupil fixed and dilated. Your next action is equals lock. Is the best indicator of TBI. Equals boots. Predictors of difficult mask ventilation can be remembered using the mnemonic equals midclavicular line. When performing a needle decompression, insert the needle directly over the top of the third rib at the equals 8 to 10. In the absence of herniation syndrome, adult patients with suspected traumatic brain injury should be ventilated at RR equals SVR. Stands for systemic vascular resistance. Equals cardiac dysrhythmia. The most serious immediate injury due to electrical contact is equals ELM. Stands for external laryngeal manipulation.